Basic principles of Ayurveda. There are three basic principles of Ayurveda. First is 5 fundamental principles. In Sanskrit they are known as Panch Mahabhuta. Second is 3 dosha principle. These are 3 basic humors. And the last principle is principles of diagnosis and treatment in Ayurveda. So we'll see the first principle, that is Panch Mahabhuta. According to Ayurveda, universe as well as human body, they are consist of 5 elements. In Sanskrit, these 5 elements are known as Panch Mahabhuta. These elements we can remember by the name Safe V. Safe V. Safe, S is for space, A for air, F is fire, and water, and E for earth. So these are the 5 elements which are, space is known as Akash, and air is known as Vayu, fire is Agni, and water is Jal, earth is Prithvi. In human body, these Panch Mahabhuta exist in combined form, which is known as 3 dosha. V, P and K. V for Vat, P is Pith, and K is Kapha. So these 5 elements, or Panch Mahabhuta, they exist in the body in combined form. Akash and Vayu, they combined and they form the first humor, that is V. Similarly, Agni and Jal, they combine and form this dosa known as Pith. Jal and Prithvi, they combine in the body and they form Kapha. So this is how the Panch Mahabhuta 5 element form 3 dosa or 3 basic humors. And these 3 basic humors seven forms of 3 dosa. 7 forms of these VPK 3 dosa is known as Sapt Dhatu. Sapt Dhatu is nothing but 7 types of tissues. 7 types of tissues in the body. These Sapt Dhatu, these types of tissues, they undergo various processes like digestion, metabolism, which is known as Agni, and they produce excretory or waste material, and this excretory or waste material is known as mala. And these mala are of 3 types, that is urine, feces and sweat. They are 3 in number. So in the basic principle, first fundamental principle, that is 5 element, which we can remember with safe, V, they combine in the body and exist in the form of three dosa, that is Vat, Pitta and Kapha. And the 7 forms of these three dosa known as Sapt Dhatu, means 7 type of tissues. These tissues, they undergo digestion, metabolism, assimilation, various processes, and they produce the waste material, that is known as mala. And these are 3 in number, so urine, feces and sweat. So from this principle there is dosa, and here we have D dhatu, M is mala and A is agni. So according to Ayurveda, health is nothing but balance of these DDMA, and disease, that is rog or vikar, is known as imbalance of DDMA. Out of this DDMA, dosa is the main culprit. Dosa is the main cause of disease. Dosa is the main cause of disease. And in case of dosa, there are 3 dosa, V, P, K. Out of these 3, this V or Vat is the main cause of disease or illness. The third principle is principle of diagnosis and treatment and Ayurveda. Diagnosis is known as Nidan and treatment is known as Chikitsa. This diagnosis is based on evaluation of status of DDMA, that is dosa, Sabdhatu, Mala and Agni, based on the evaluation of status of DDMA. There are 2 methods of diagnosis. One is Rog Nidan, that is diagnosis of disease, and there is Rogi Nidan, means clinical examination of the patient. Clinical examination. This clinical examination is further divided into 3-fold examination, 8-fold examination and 10-fold examination of the patient. So there are 2 methods of diagnosis. One is the diagnosis of disease, that is Rog Nidan, and one is Rogi, that is patient clinical examination. 3-fold examination, 8-fold and 10-fold, which includes palpation, inspection and pulse examination, urine and feces examination. This comes under the clinical examination of the patient. Then the treatment in Ayurveda. The main aim or purpose of the treatment is to restore the equilibrium of these dosa, dhatu, mala and agni. There are 3 methods of treatment. First is the prevention, that is known as Nidan Parivarjana. Second is palliative therapy. Palliative therapy is known as Samsana in case of Sanskrit, and this can be achieved with the help of Ahar, that is food, Vihar, that is lifestyle, and Dravya, that is drugs. So these are the 3 methods to achieve the palliative therapy: food, lifestyle and drug. Then the third or last method is Samshodhan method, which is the biocleansing therapy. and this can be done with the help of Panch Karma. Panch Karma, Panch means 5 and Karma is therapy. So there are 5 therapy involved in detoxification of the body. These 5 therapies may be remember with this 5. We can write 5 like this and it is a number. It is a number. So the trick is the 5 number NBR. NBR. This V is woman, that is to induce vomiting. Induce vomiting. And second V is Varchana, that is to induce purgative action. Purgation. And NBR. N is the Nasya, nasal installation of the medicine, and B is known as Basti, which is nothing but enema, and R is your Rakt motion, Rakt Moksh, that is detoxification of the blood. Summary of the basic principles. As we discussed, there are 5 elements which form 5 bhutas, that is Panch Bhuta, and these Panch Bhuta, they form 3 dosha, that is V, P and K. And the 7 forms of these are known as 7 dhatu, which 7 dhatus means 7 type of tissues. They undergo metabolism, excretion, they undergo metabolism and other kind of transformation, digestion, that is known as Agni. As a result of this, there is formation of Mala, that is the waste product. So these dosha, dhatu, Agni and Mala, the balance of these is known as health and imbalance is known as disease. Imbalance is known as disease. Then in case of disease, diagnosis and treatment. There are 2 methods of diagnosis, diagnosis of Rog and diagnosis of Rogi. Then treatment, there are 3 methods. There is Panch Karma, that is 5 therapies, which is 5 number NBR. V is woman, to induce vomiting, and another V is Varchana, to induce purgation. NBR is your Nasya, that is nasal installation of the medicine, and B is the Basti, which is nothing but the enema, and R is the Rakt Moksh, which is detoxification of the blood. Detoxification of blood. So these are the basic principle of Ayurveda, where we started with the 5 element. We started with the 5 element or 5 Panchmadbhuta, 3 dosas, 7 dhatu, then Agni, then 3 malas. The balance or disbalance, they define the health or disease status. Then we can diagnose the disease itself or the clinical examination of the patient. And treatment, there are 3 methods. One is prevention, palliative therapy with food, drug and lifestyle, and the specialized therapy is the Panch Karma, where 5 is the number, where 5 is written as V and number is NBR. So that is Vaman, Varchana or Nasya, Basti and Rakt motion. So this is all about basic principle of Ayurveda.